Hello, in this presentation we will discuss detectors in X-ray CT. We will cover various basics of X-ray CT, as well as applications, the future, and as well as future developments in various detectors of X-ray CT. However, we need to start with the basics.
What are CT scans? Computed tomography scans are medical imaging procedures that can be utilized to produce detailed images of the body. These detailed images allow us to diagnose muscle and bone disorders such as tumors and fractures. It can also help us monitor diseases within a patient. After the patient has been diagnosed, a doctor will then recommend the patient to undergo medical or surgical treatments. How do CT scans work? CT scans utilize a narrow beam of X-rays that are aimed at the patient and are slowly rotated around the body in order to produce a cross-sectional image. The X-ray beam produces a signal that is then processed through a computer and allows us to generate detailed images for diagnostics. The beam is not fixed unlike a typical X-ray scanner. The source is motorized around the circular shaped opening of the CT machine and shoots a narrow X-ray beam. What detectors are used in a CT scan? There are two types of detectors used in a CT scan. These include xenon detectors and solid-state detectors. Xenon detectors, they consist of two metal detectors which surround high-pressure xenon gas. A voltage is also applied to the two metal detectors. When the X-ray beam passes through the patient, it interacts with the xenon gas and causes ionization. Ionization of xenon atoms causes buildup of electrons and also creates an electric field. The electrons move towards a positively charged detector and will eventually cause a buildup of charge on the anode. The buildup of charge is transferred into an electrical signal that is displayed onto a computer. The computer then determines how much radiation was attenuated by the body. The second type of detector is a solid-state detector. Solid-state detectors consist of a scintillator and a photodetector. When the X-ray beam interacts with the scintillator, light is emitted. The light emitted then reacts with the photodetector and converts light into electrical signals that is then transferred to a computer to determine how much radiation was attenuated by the body.
This segment will talk about applications of X-ray CT. So when are CT scans utilized? Well, CT scans can be used a wide range of things. They can vary from serious injuries to bones/tissues, detecting infections, or to diagnose abnormal anatomy. It is preferred over regular X-rays in various situations, as it can provide 3D images of a specific organ or tissue structure, which can illustrate fractures, tissue damage, and tumors, in comparison to X-ray, which can only detect dense structures such as the skeletal system in only a 2D image. CT scans are usually preferred in more serious cases over ultrasound due to its high sensitivity. CT misses fewer cases than ultrasound and thus is highly preferred in detecting things such as abdominal pain and symptoms that show early signs of diseases. There have been numerous niche uses outside of the medical industry for CT, which include electrical and electronic devices in homogeneous materials as well as the food industry. There are many limitations which may require the use of other methods of imaging. Cost of CT scans is very high, ranging from $1,400 to $2,500 per patient. This is due to many factors, such as the use of equipment and the need of a radiologist to comprehend the image. Although the radiation emission is usually low and practically safe, the radiation doses are still high for certain areas. To a certain extent, CT scans are harmful due to the exposure to radiation and an increased chance of receiving cancer. However, the radiation dosage is usually controlled to prevent further damage to the patient. As depicted in the table shown, the doses to the chest, abdomen, and pelvis are significantly higher in CT imaging in comparison to conventional X-ray, which illustrates the risk of higher radiation dose, increasing the risk of developing cancer or other deformities. The diagnostic accuracy of CT images can be deterred by many factors. If a patient has a metal implant, the CT image produced will be ruined by a streaking artifact. Another issue includes partial volume artifacts, where another tissue mimics pathological condition, which can lead to misdiagnosis if not noticed. The potential applications of CT in the future may include the reduction of radiation dosage. As radiation dosage is a concern, efforts will be made in order to reduce it. However, a decrease in radiation will lead to a decrease in image quality. To tackle this, replacing mechanisms other than the current attenuation, which leaks out a lot of radiation, with phase delay will significantly reduce the amount of radiation needed to create an image. By the use of multi-detector CT scanners, there have been improvements in displaying airways, vessels, and various nodules. By further improving the use of multi-detectors, the overall image quality and resolution will increase.
So let us discuss about some new advancement in X-ray technology. The first one is true intensity control X-ray. This type of technology is firstly developed by faint focus. In this type of technology, the intensity level of X-ray is more controlled and stable, so it provides a highly sharp and consistent image in comparison to traditional X-ray. Now let us talk about radiation imaging detectors. The desired characteristic for radiation imaging detectors are low cost, high light output and short decay time. Ceramic detectors like GGAG, GOS and GAGG are most popular nowadays because of their low cost. Now let us discuss about the operation. Thin ceramic detector is used as scintillator coupled with photomultiplier tube through light guide. The photomultiplier tube detects scintillation light produced by interaction between ceramic plate and radiation and converts photon to photoelectrons by photocathode. These photoelectrons are multiplied by mesh dynode. These electrons are detected by the crosswire anode of photomultiplier tube, and the anode signals are fed to the amplifier of data acquisition for position and energy calculation. Now let us discuss about thermoluminescent detectors. They are the specialized type of detectors that are used for X-ray diagnostic of plasma object. They are composed of lithium and calcium fluorides that are activated by alumophosphate glass. They are very less susceptible to electromagnetic noise, so they can give rise to linear response in the wide range of absorbed doses.